this evening, and we're not done yet, by all means, take it back. Take it home. Take it to your church. Take it to the place where they exist for social responsibility and social justice, and share that knowledge. Now, I'm going to speak very, very, very briefly, not about any health problems, but about the differences between the public option, which is part of H.R. 3200, and many of the other bills that are circulating around the House and the Senate, and then also H.R. 676, to make certain that people really understand the difference. Because what I've discovered in doing town halls is that a lot of people really don't know the difference. The first difference between the public option and single-payer Medicare for all is the public option does not exist, and it will not exist until the year 2013, because it will be part of the health insurance exchange, and the first year of the health insurance exchange is 2013. So when we think about the fact that roughly 18,000 people a year die due to lack of ability to access health care, waiting until 2013 means an extra 80,000 people are going to die, because we wanted to build some additional convoluted infrastructure, and we wanted to make sure that the health insurance companies got a lot more of our money. I think that is criminal. It is really criminal. Now, number two, it's going to take so long to get, quote, the public option like Medicare because it doesn't have any infrastructure. Well, there's something really, really simple we can do. We can say, you know what? The solution to all of this is simply Medicare. It's Medicare for all, H.R. 676, or the Wiener Amendment, 3.3% of your income as a tax. I'm going to say that nasty tax word. In the health insurance exchange, some of you have my sheet that I gave you that shows the money. Health insurance can take up to 12% of your income. Now, the good thing is it's going to max out at 12%. I know people who are paying 28% of their income for health insurance. So for them, their health insurance costs are going to go down. They're going to go down to 12%. All right, now let's turn that into real money. Insurance is so expensive that they are basically going to subsidize people up to 400% of poverty level. So if you are single and making $43,200, 12% of your income, your insurance premium, will be $5,198 every year. Additionally, there will be a 30% copay. Now, this is the basic insurance. There are 4 levels, so it started with the least expensive. You will have a 30% copay. So that means a person making $43,000 a year could be looking at a health care expenditure of $6,700 a year. Or your option is, if you choose not to buy their insurance, and by the way, it will be against the law not to buy health insurance. Health insurance is mandated by law. Then you will be dealing with the Internal Revenue Service. The IRS will be the enforcement or the collection arm for health care. I guess I missed the memo where the IRS was somehow involved in health care. But they are now in 3,200. And the main reason they're involving the IRS in healthcare is they are setting up the infrastructure, because the insurance companies will be reporting the name of every human being they insure on one of their policies directly to the IRS, because they are getting ready to tax the health insurance. All right? So that's what we're getting under 3,200. Mandates. We're the problem with healthcare. It's the consumers. We are bad, irresponsible, terrible, awful people who didn't buy health insurance. Let's ignore the fact that some of us, like me, cannot get insurance because of pre-existing conditions. Let's also ignore the fact that some of us don't have health insurance because they simply can't afford to pay for it. So now there will be a law that says you have to buy health insurance. There's no law that says you have to have a place to live, and there's no law that says you have to have food to eat. But there will be a law that says you will have health insurance. So I guess when you're starving and you collapse on the street, since you're insured, they'll take you to the hospital and they'll feed you. Okay, I guess that's where they're going with this. All right, now, under HR 676, that same person would pay $1,066 for medical, dental, vision, negotiated pharmaceutical, mental health on parity with physical health, and all and any necessary medical procedures. Under 3,200, you get basic health care. You get your health care, hospitalization. Now, they do make insurance companies cover maternity care, and they will also have to cover well baby care. And children up to the ages of 21 get dental and vision. Their parents don't. So we can have bad teeth and go blind as far as the insurance companies are concerned. We don't get that on the basic plan. Now, since it's a 4-tiered plan, basic, enhanced, premium, and premium plus. Premium plus is where we see dental and vision for adults. This sets up major health disparities between women, between minorities, and between anybody who is not making the most money, because you can't afford the good insurance and you get the biggest co-pays. 70-30 on the basic plan. Now, if you can afford enhanced, or if you can afford premium plus, that's 95-5. I mean, it's really amazing. We are legally setting a precedent to oppress women, the poor, and minorities with their health care. And I don't think that's fair. I don't think that's fair. On families, if you've got family care for 4 people, we're subsidizing people up to $88,000. Now, we're going to ask them to pay $10,500 a year for their insurance, and then we're going to turn around and on top of that, ask them to pay, I think it was another $2,000 or some odd dollars in terms of co-pays. Under single payer, Medicare for all, that family, for everything, would be paying $2,900 a year. So it is not affordable. It's not. I mean, it's affordable if you're making $168,000 in theory. But again, they're paying 12% of their income with a 30% copay if they're going in for the basic plan. So we have really got to get busy, and we've got to really start working on this and letting people know the public option is so not the solution. It sells America to the health insurance companies as slaves. And was that really what we were trying to do? We wanted to get affordable, universal health care. And instead, we're going to get a legal yoke around our neck that says you're going to buy insurance, and if you don't, where there's crime, there will be punishment. All right, now, what we're going to do next is, I'm the master of ceremonies, or mistress of ceremonies, I have to keep the program moving. I'll make one last call if anybody would like to talk about their own healthcare situation. If not, come on up.
I'm getting over a cold, so I hope my voice will hold out. I actually wanted to share with everyone the most amazing and wonderful experience that I had in the healthcare system in Germany. Because it didn't happen here. I, as a child, was a dependent of the armed forces, and as a dependent, I received completely paid for, socialized, universal, however you want to call it, medicine. And the way that it works, it was amazing, is that you get sick and you go to the doctor, and